Hello everyone. You may know that heart disease or cardiovascular disease, CVD, affects the heart and blood vessels and causes over 40% of all deaths in the United States each year. Many people who develop heart disease have never had any symptoms or warning signs. They are unaware that they are at risk until the disease has already advanced quite far. However, there are many risk factors that can be controlled with lifestyle changes and medications to help prevent or delay the onset of heart disease. Educate yourself on these risk factors of heart disease to ensure you can take steps to protect your heart health as much as possible. Let's get started. Risk number 9 is sedentary lifestyle. Inactivity or a sedentary lifestyle is one of the biggest risk factors for developing cardiovascular problems. If you sit for more than 6 hours each day or work at a desk, then your health may be at risk from all that sitting. As much as possible, try to get up and walk around during your workday. Even if it's just a 5-minute break to stretch every hour, it will make a big difference over time. Even an extra 30 minutes of physical activity each day can improve your health and decrease some of these risk factors. This exercise doesn't have to take place in one sitting either. It could be broken into 10-minute chunks throughout your day. It's also important to remember that exercise isn't only about losing weight or building muscle. It can also help reduce stress and anxiety, which are often precursors to bad habits, like smoking. Risk number 8 is alcohol use. If you drink alcohol, limit it to no more than 1 drink per day for women and 2 drinks per day for men. Drinking more than that can increase your risk of developing cardiovascular disease. 1 drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces, 1 shot, of 80 proof liquor. Remember, those measurements are by volume. If you're measuring by shots, you're likely drinking too much. Also avoid binge drinking defined as 4 or more drinks at a time, which also increases your risk for developing cardiovascular disease and other conditions. Heart disease is a leading cause of death in America, killing about 610,000 people each year. Many Americans don't realize that certain behaviors, including tobacco use, physical inactivity, and poor diet, are major risk factors for heart disease. More than half of all deaths from heart disease can be prevented through lifestyle changes, such as not smoking, getting regular exercise, and eating healthy foods like fruits and vegetables. People who already have existing problems should talk with their doctor before making any changes to their lifestyle. Risk number 7 is poor diet quality. If you're trying to lose weight, an obvious place to start is by eating fewer calories. That said, what you choose to eat and drink is just as important as how much you consume. In fact, unhealthy foods and drinks are a leading cause of excess calories that contribute to being overweight and obesity. Foods high in fat, particularly saturated fats, sugar, sodium, or calories from any source can put an unnecessary strain on your heart and your waistline. Making smart food choices will help keep your blood pressure and cholesterol levels healthy. A good diet also includes plenty of fruits, vegetables, whole grains, lean proteins, nuts, seeds, legumes, and low-fat dairy products. Risk number 6 is family history of heart disease. A family history is one of the strongest risk factors for heart disease, but that doesn't mean you can't take steps to protect yourself. While it isn't something you can change, at least you can be aware and seek regular checkups from your doctor. Having a parent or sibling with coronary artery disease makes a person 10 times more likely to have it themselves. A study found that 70% of men whose fathers had myocardial infarction were also diagnosed with MI by age 40, while just 29% in a control group developed it within 12 years. Those whose mother had heart issues are twice as likely to develop coronary artery disease than those who didn't have either parent affected. If you think you may be susceptible to heart disease due to genetics, talk to your doctor about ways to manage your risks. You may want to consider taking statins and getting an exercise plan going early on. This will help lower cholesterol levels, which could reduce your chances of developing plaque buildup in arteries and potentially having a heart attack or stroke later on down the road. Risk number 5 is stress and anger management. It's easy to assume that stress and anger are separate emotions, that one feels stressed and another gets angry. But stress, in many ways, is just a blanket term for any emotion you feel in excess. That includes anxiety and fear, aka negative stress, but also happiness and excitement, aka positive stress. The negative impact of high-stress periods on your health far outweighs any benefits from feelings of elation or enthusiasm during low-stress times. In fact, people who experience frequent spikes in their emotions aren't just at an increased risk for developing heart disease and stress-related disorders. They also tend to be less healthy than those who can stay calm under pressure. If you have trouble managing your stress levels, it may be time to get professional help. If not, take steps like making sure you don't overcommit yourself, setting aside time each day for relaxation activities like yoga or meditation, and finding ways to reduce daily hassles. Risk number 4 is diabetes mellitus. Nearly 85% of all people with diabetes are either overweight or obese. That's because excess body fat seems to encourage insulin resistance and higher blood glucose levels, two features that accompany type 2 diabetes. If you're at risk for developing type 2 diabetes, it's important to take control of your body weight. Talk to your doctor about ways you can get more active and eat a healthy diet, perhaps by reducing your intake of refined carbs. Work up to 150 minutes per week of moderate exercise, brisk walking, swimming, or 75 minutes per week of vigorous exercise, running, basketball. Start with a 5-minute daily walk. Work up over time so that you're working out 5 days a week for 30 minutes each day. For example, try brisk walking for 3 days, then jogging on alternate days, or alternate between brisk walks and jogging every other day. If you're already diabetic, try to lose weight if you've gained 10 pounds or more since your diagnosis. Being overweight is a major risk factor for heart disease, as well as diabetes. For example, losing just 10 pounds can lower your cholesterol levels, in some people, enough to cut their risk of having a heart attack in half. Risk number 3 is sleep apnea. People with sleep apnea stop breathing for short periods of time during their sleep. This causes blood oxygen levels to fall and blood pressure to rise, potentially putting them at risk for stroke, arrhythmias, abnormal rhythms, heart failure, and sudden death. Sometimes symptoms can be mild and not obvious. However, they can be severe enough to disrupt your sleep throughout an entire night and result in serious complications. If you have any of these signs or symptoms, talk to your doctor about getting tested. Loud snoring that stops suddenly while sleeping, feeling tired after waking up from a deep sleep, restless sleep, morning headaches, or sore throats. If you think you might have sleep apnea, it's important to see a doctor as soon as possible. A simple test called polysomnography is used to diagnose sleep apnea. Risk number 2 is high blood pressure, hypertension. According to a study in the Journal of American Medical Association, people with borderline hypertension have twice as much risk for developing heart disease. High blood pressure, or hypertension, is a condition in which blood flows through arteries with too much force, causing damage to artery walls and organs. If left untreated, high blood pressure can lead to life-threatening health problems, such as stroke and kidney failure. To lower your blood pressure naturally by eating a healthy diet including vegetables and fruits while exercising regularly, you should always consult your doctor first before changing your diet or exercise routine. If you are currently taking medication for your high blood pressure, it's important that you don't stop taking it without talking to your doctor first, because doing so could cause serious complications. Risk number 1 is lipid disorders, dyslipidemia. Elevated levels of lipids, or fats in your blood, can increase your risk for coronary artery disease. Lipid disorders include high levels of low-density lipoprotein, LDL cholesterol, and triglycerides, and low levels of high-density lipoprotein, HDL cholesterol. Certain lipid disorders are hereditary, but some are a result of life choices, such as smoking, poor diet, and lack of exercise. However, there is good news. If you have these risk factors for heart disease, you can reduce them with diet changes. nutritional supplements, and regular exercise. Controlling your weight is another good way to reduce your risks for cardiovascular problems. With every 5% that body weight increases from being overweight comes an 8% rise in mortality from all causes. Losing weight through proper diet and exercise will help lower your LDL and total cholesterol levels while increasing HDL. Regular aerobic activity will also improve your circulation by reducing arterial plaque buildup. In addition to making healthy lifestyle changes, it's important to consult with a physician about medications that may be prescribed for you, if necessary. In conclusion, it's very clear that many things can increase your risk for developing heart disease. The good news is that you don't have to live with any risks. Changing your diet and exercising more can eliminate a lot of these factors. If you know someone who might be at risk or you notice symptoms in yourself, your doctor should be able to assist you in finding ways to lower your risk and perhaps even improve an existing condition. We hope you enjoyed learning about risk factors of heart disease. If you have any questions, please feel free to comment below. We'll get back to you as soon as possible.